Hello, my name is Ryan Oates. Welcome to A Perfect World. Recently, I've been thinking about the alleged murder of United Healthcare CEO Brian Thompson by Luigi Mangione. I've seen people call Mangione a folk hero, shouting, "Free Luigi." Can we think about how dystopian that is? Someone was murdered in broad daylight, and people are reacting by making jokes and celebrating. My view in this situation is that two things can be true at once. Murder is bad, and the US healthcare system also bad. So today, let's look at how our healthcare system works now, why it's broken, and how we can fix it. In a perfect world, I think that healthcare would work the way a child thinks it works. You go to the doctor, you tell the doctor how you're feeling, the doctor says, "Here's how I can help," and then you get care. Ideally, we would treat healthcare as a human right. No matter how much money you have, where you work, where you live, no matter what, you're sick, you get care. But in the United States, the story's not that simple. For many people, our healthcare system is far too complicated and far too expensive. The United States has a multi-payer system, meaning that people get their healthcare from a lot of different places. About 36% of people get their healthcare from a public program, like Medicare, Medicaid, and Veterans Affairs. Some people have no insurance. 8% of people, that's 26 million people in the US, have no insurance at all. In some states like Texas, the uninsured rate is as high as 18%. But the vast majority of Americans, about 65%, get their healthcare through private insurance, and they typically get that through their employer. So when you're having that conversation between you and your doctor, there's this third person metaphorically in the room, the insurance company. And the problem is that at its core, the goal of the private insurance industry is not to make people healthy. It is instead designed to make money. And I'm not saying that as a dig to insurance companies, that's just the way corporations work in the US. There's this strand of thinking called shareholder primacy, the idea that shareholders come first. This concept was articulated first in the 1919 Michigan Supreme Court decision, Dodge v. Ford Motor Company. The court's decision said that there should be no confusion. A business corporation is organized and carried on primarily for the profit of stockholders. While this is not a legal mandate, scholars have pointed out that it is a standard of conduct. So in practice, the way things play out on the ground, the main goal of a corporation is to make money for shareholders. And because the main goal is to make money and not necessarily to make people healthy, the private insurance industry has found a lot of different ways to actually prevent people from getting healthcare. So let's look at a few of the strategies that insurance companies use to prioritize profits over people. The first strategy will require us to time travel back to my childhood. When I was a child, there was a period of time when my father had left his job and we were temporarily uninsured. And I remember overhearing my parents talking about how difficult it was going to be for me, an 11-year-old child, to get insurance because of my asthma. And this is the first time I heard the term pre-existing conditions. Back in the olden days, before the Affordable Care Act of 2010, if you were labeled by an insurance company as someone with a pre-existing condition, they could charge you a higher premium or monthly payment, or even deny you coverage. An organization called Consumer Watchdog uncovered internal documents from PacifiCare, a private insurance company that has since been acquired by United Health Group. In this 2003 document, the company explained to its employees that because of the potential additional risk, read that cost, associated with certain medical conditions, some applicants will be declined for all coverages. And this concept of pre-existing conditions was applied very broadly. For example, the report listed certain jobs like being a firefighter, a police officer, a steel worker, or an offshore oil worker. These are public servants and working class people who are doing dangerous jobs and are often being paid far less than they should be. And instead of thanking them, insurance companies penalize them by denying them coverage. There was also a list of medications that were cause for denying coverage because, as the document says, the cost of a medication is considered part of the insurance risk. This includes Flovent, the inhaler that I used as a child. And then there's this huge list of conditions. which included everything from being pregnant to being an expectant father to having acne to going to therapy in the last 6 months. Probably worst of all is that in 1994, the House Judiciary Committee did this informal study with insurance companies, and half of the insurance companies said that being a domestic violence survivor was a pre-existing condition. So if a person had been the victim of domestic abuse, that could play a role in them being denied coverage. So you could see how all these pre-existing conditions add up to a world where the most vulnerable people, the people who really need healthcare, could be left either paying extra or without coverage at all. Thankfully, with this particular issue, the US government stepped in to protect vulnerable people from insurance companies. In 2009, Congress passed the Affordable Care Act. The ACA, which came to be called Obamacare, established a patient's Bill of Rights, which made it illegal for insurers to discriminate against children with pre-existing conditions, like me. It passed in the House on a party line vote with support from 219 Democrats and 1 Republican. Later, in 2014, the rules were extended to adults so that no company could deny coverage to anyone just because they actually need healthcare. So in this particular sense, we've seen the US government take steps to protect vulnerable people from insurance companies, at least for now. Looking at you, JD Vance. The story of pre-existing conditions helps us to understand how insurance companies think. When left to their own devices, private insurance companies will exclude the people who are most expensive to insure in order to provide as few services as possible and to make as much money as possible. Another tactic that insurance companies use is denying claims. The issue of insurance companies denying claims has been a hot topic recently because the words deny, delay, and depose were written on the side of some of the shell casings found at the scene of Brian Thompson's killing. These 3 words are very similar to the title of a 2010 book criticizing the US healthcare system entitled Delay, Deny, Defend: Why Insurance Companies Don't Pay Claims and What You Can Do About It. Claim denials work like this. You talk with your doctor, and you and your doctor agree that you medically need something, a scan, a surgery, etc. And then the insurance company, that third person in the room, says, no, we're not going to pay for that. And the consequences can be dire. Here's what claim denials can look like in practice.
Anthony DeLaura is fighting a rare cancer for 2 years now.
Originated as a tumor in the appendix and then spread to additional abdominal organs.
His wife Jackie has been on this tough journey alongside him. What makes it even harder is that they say he's been approved for a life-saving surgery by doctors at Cleveland Clinic in Ohio, but their insurance has denied the multi-organ transplant 3 times.
How's that possible? We were approved for all the testing at the clinic to lead up to the transplant.
A denial letter from Empire Blue Cross Blue Shield says the surgery is investigational.
That this has not been done many times. They've continued to ask for more documentation, which I know has been provided.
The Ohio surgeon completed the surgery on one other patient in that state and was successful. Anthony's family says this is their last hope.
Facing your own mortality is hard enough without having an insurance company tell you over and over again that, financially speaking, you're not even worth the cost of trying to save you. And this is not an isolated incident. Insurance companies deny an unreal amount of claims. United Healthcare, for example, denies 32% of all claims. That's basically 1 out of every 3. And I would argue that part of the reason that they deny claims so often is that they assume that the vast majority of the time, people won't put up a fight.
When health insurance companies deny claims, an appeal is not very likely. Federal data shows that companies issued more than 49 million denials in 2021, but customers appealed only about 0.2% of them.
So most of the time, people don't appeal a denial and end up going without care. Some insurance companies are not even taking the time to have an actual human look at your claim. Companies like Cigna have allegedly been experimenting with just letting AI do it.
Ali Rogan explores how at least one major health insurance company is using artificial intelligence to assess and often deny claims in bulk.
Investigative journalists at the nonprofit ProPublica found that the health insurance company Cigna uses an automated system that allows it to instantly reject claims on medical grounds without even opening the customer's file.
We learned that there is a process that was developed at Cigna about a decade or so ago in which they created this algorithm that says we're going to approve them if they match certain conditions, but if they don't match another condition, then it will be sent to the company doctor, and that doctor is going to quickly sign off on rejecting that claim and saying we're not going to cover it. In 2 months last year, that happened in an average of under 2 seconds. So they wouldn't even open a patient file, but they were signing their name off and saying, actually, this claim is not medically necessary, and so we're not going to cover it.
Beyond just the AI, with this next clip, I want to look at the strategic way that Cigna is thinking about these denials.
We actually found through our reporting that Cigna had a presentation in which they were putting forward the idea to put autonomic nervous system testing through the system. And in the cost-benefit analysis, assessing whether to do this, they assumed only 5% of patients would end up appealing this. And that was part of the calculation of whether to put this test into this process or program or to leave it out.
So according to ProPublica, denying claims is a calculated part of the business model. If they deny you the care that you need, they can calculate that most of the time you're not going to put up a fight. This is just another way that private insurance companies put profit over people's healthcare needs. We've talked about the ways that private insurance companies prevent people from getting care. But when you do finally get healthcare, there's another question, which is, who's paying? While we're on the topic of Cigna, I want to talk about a recent guest essay from the New York Times by Wendell Potter entitled, "I Was a Health Insurance Executive. What I Saw Made Me Quit." In this essay, the former president for corporate communications at Cigna wrote, "I left my job as a health insurance executive at Cigna after a crisis of conscience. This started when the chief executive announced the company's latest strategy, consumerism. They created the term in order to shift hundreds, and in many cases, thousands of dollars in healthcare costs onto consumers before insurance coverage kicks in. So insurance companies have strategically shifted the burden of paying for healthcare back onto the individual. One way they do this is what is called a high deductible insurance plan.
People are finding the deductible so unaffordable that they're putting off care or they're not getting care at all. They're not filling prescriptions, they're not going to the doctor."
Monique Dow's only insurance option carried a $6,000 deductible. She put off surgery and almost didn't discover that she had cancer.
It was scary to me that I almost didn't do the surgery, the first surgery, to just know what was growing inside my body because I knew it was going to be a lot of money.
This is not a standalone case. Research suggests that in 2019, 25% of Americans delayed care because of costs. And in 2022, 28% of Americans skipped getting care altogether because it was too expensive. As Bruce Jaspin of Forbes puts it, when people don't go to the doctor, a claim isn't filed with the health plan, so the insurance company makes more money. When insurance companies don't pay for healthcare, which should be their only job, people turn to drastic measures to get what they need.
If you visit GoFundMe.com, you'll see a lot of hopeful stories. Some lighter, like a trip to Iceland or supporting a budding artist, but others come with more urgency.
Posting the GoFundMe was definitely a move of a last resort. It was a last resort, and it was out of desperation.
Kyle Kidd, a comedian on TikTok, never thought he'd be at the center of a post on GoFundMe until his mom was diagnosed with stage 4 inflammatory breast cancer.
And when people are fighting for their lives, that's the last thing that you want to worry about is money.
With bills totaling close to $200,000, Kyle says he wasn't left with much of a choice.
We knew that if, we didn't have that money, that she would die.
I again just want to say how dystopian this feels. Your chances of getting life-saving care can depend on getting enough social media attention. It's no wonder that medical debt is the leading cost of bankruptcy in this country. If we're paying for more and more healthcare out of pocket, then what's happening with those monthly premiums? The question becomes, what are insurance companies spending that money on? And experts have pointed to one answer to that question: administrative costs. To start off with a simple definition, administrative costs are the costs of things like billing, finding and managing in-network clinicians, claims management, prior authorizations, and the administrative tasks that doctors do. And it's important to note that not all administrative spending is wasteful. You need some level of administration in order to keep a healthcare system working. But the US spends significantly more on administrative costs than other wealthy countries. And Health Affairs has estimated that half of our administrative spending is wasteful. Research suggests that a lot of wasteful spending has to do with the complexity of our multi-payer private insurance system. In 2020, a study in the Annals of Internal Medicine explained that part of the reason our administrative costs are so high is that interacting with multiple insurers with varying fee schedules, deductibles, and prior approval requirements, formularies and referral networks, and the flux of patients among insurers also drives up US physicians' overhead costs, and hence the fees they must charge. So if I'm understanding the research correctly, the complex nature of having all of these private insurance companies leads to more expensive healthcare. Another unnecessary cost that I think often gets overlooked is that some of those premiums, that monthly payment that we give to insurance companies, instead of being used on healthcare, gets used on political spending. I've spoken about the role of money in politics before and how the Citizens United Supreme Court ruling gave corporations more political power, and this is just another example. Out of the top 3 industries that spend the most on political lobbying, 2 of them are insurance and pharmaceuticals. As one of the world's top health policy experts, Tsung-Mei Cheng puts it,
in America, hospitals, doctors, pharmaceutical companies, they are very, very strong and powerful. You are basically controlling their revenue and profit. So here you have the political reality of a very powerful supply side against a Congress which basically accepts their political contributions.
And so it's no wonder that they have used that political power to protect themselves from regulation. The denial rates, the high deductible plans, out-of-pocket costs, all these tactics that prevent people from getting healthcare and shift the burden of paying for it back onto the individual. All this is designed in a way that will benefit the shareholders and increase profit. Okay, enough about the problem. How do we fix it? How do we create a healthcare system that covers everyone, is simpler, and is more affordable? Let's look at some solutions. In my opinion, a much simpler and more cost-effective healthcare system would be what is called a single-payer system, where instead of having private insurance companies with doctors that are in-network and out-of-network, everyone would be under a public program that is run and paid for by the government. Canada, a country with a single-payer system, spends half as much on administrative costs as we do. And researchers say that one reason it is less expensive is that physicians send bills to a single insurer, which cuts out a lot of administrative tasks. One of the best examples of a single-payer system is in the UK. Let's look at the UK model following the life of a young boy named Liam.
Even with the help of his mom, Liam Murphy still struggles to wake up each day.
I thought you would be dreaming about Charlotte, right? Why Charlotte?
Liam has Down syndrome, epilepsy, and chronic lung disease. He's dealt with these since the day he was born. The 10-year-old lives in Watford, England, with his parents, Gary and Angelina, and big sister Laura. They have to be constantly vigilant for trouble.
Don't start. You're okay, Liam. Can you get the mask, please?
Like this seizure.
You're all right. Come on out of that.
Dozens of times a year, episodes like this will send Liam to the hospital. He is always at risk of dying.
Good boy, Tom.
Liam's life and the incredible care he gets are a testament to the United Kingdom's National Health Service, known as the NHS. Residents of the UK pay taxes to the government that support the NHS. The government is then the single payer for healthcare. It pays doctors and hospitals and covers nearly all costs.
Seatbelts on.
For Liam, that's all his medicines and hospitalizations. It pays for caregivers that come several times a week. The NHS even paid for this chair and standing frame to help him exercise.
He's been out for about half an hour now, hasn't he? So that's really good, Liam.
No one says, well, that's going to cost too much, so we're not going to do it.
You've never heard those words?
No, and if we call an ambulance will be here in 5 minutes to pick Liam up and take him to hospital.
I think Liam's story shows how in a single-payer system, when you need healthcare, you get healthcare. You don't need to worry about cost. You don't need to worry about your doctor being in-network. You don't need to worry about the insurance company accepting your claim. You just get healthcare. At the time that this documentary was filmed, the NHS was very popular. But in recent years, it's become less popular. Some have pointed to some possible reasons why it's become less popular, including the government's unwillingness to fund the program, with the biggest cuts since the 1970s happening recently. And as a result of underfunding, there are longer wait times, and people are being forced to pay more and more out of pocket. So what I'm saying is not that the UK's system is perfect, but if funded properly, a single-payer system can be much simpler and much less expensive. Even with the way it is now, people in the UK spend far less on healthcare than we do in the US. And their system works better for people's health. In the UK, far fewer people die from preventable and treatable causes. So turning back to the US, a few members of Congress have taken the lead on single-payer healthcare, including Representatives Pramila Jayapal, Debbie Dingell, as well as Senators Bernie Sanders and Elizabeth Warren. Throughout the late 2010s and early 2020s, they've proposed a series of Medicare for All plans. And these plans are even more ambitious than the UK's NHS. Representative Pramila Jayapal explains.
Today, I wanted to briefly tell you what would be covered. Our broken for-profit healthcare system currently leaves millions of people without coverage for vision, dental, mental health, and reproductive health. And that is a huge and expensive problem. The average dental cleaning is $200 out of pocket. Mental health visits can be hundreds of dollars for each appointment. And even with insurance, it can still cost a new mom $4,500 to give birth to a healthy child. Medicare for All will ensure that these essential aspects of healthcare are fully covered and with no hidden fees. It's time to guarantee comprehensive healthcare as a human right in this country. And Medicare for All will make that happen for everyone in America.
So Medicare for All would cover far more health services than our current insurance system. Now, I'm sure many people are going to ask, how are we going to pay for that?
Is there an increase in taxes on the middle class to pay for Medicare for All? Or rather, where would the tax burden go to pay for that?
Okay. Under my legislation, which has 15 co-sponsors, I believe, in the Senate now, nobody in America will pay any more premiums. Just talked to a woman the other day who pays $1,700 a month, $20,000 a year, gone. No more co-payments, gone. No more out-of-pocket expenses, gone. Nobody will go bankrupt. Right now, 500,000 people in America go bankrupt because of medical bills. All of that is gone. Nobody in America under my bill will pay more than $200 a year in total for their prescription drugs, and will stop the ripping off of the American people by the pharmaceutical industry. Now, having said that, is healthcare free? No, it is not. So what we do is exempt the first $29,000 of a person's income. You make less than $29,000, you pay nothing in taxes. Above that, in a progressive way, with the wealthiest people in this country paying the largest percentage, people do pay more in taxes. But if I say to you that right now you're paying $20,000 a year in a tax called a premium for the insurance companies, that's gone. And then I say, Stephen, you're paying $10,000 a year now to the federal government, you're $10,000 to the good. You'd ask me, where do I sign up for that?
I want to latch on to something he said there, and that is the idea of progressive taxation. Right now, the richest 400 families pay a lower tax rate than the middle class. But when the wealthy pay their fair share in taxes, then we can fund our social safety nets, like healthcare, and the rest of us can get our basic human needs met. And if we can make this happen, then our healthcare system might look more like we imagined it to be when we were children.
It's a simple system. Go to the doctor you want to. Hi, my name is Mary Smith. Thank you. Sit down. Get care. Thank you. Have a nice day.
Wouldn't that be nice? If you're interested in making single-payer universal healthcare happen, I would first suggest voting for candidates who believe in healthcare as a human right. The next step would be to build political power. You could support the campaigns of those candidates, or consider running for office yourself. There are also a lot of organizations working on universal healthcare, and I'll list a few of them here. Of course, there are plenty of state and local orgs as well. In Massachusetts, where I live, the organization MassCare is working very hard on this issue. If you'd like to learn more about single-payer systems or other alternatives for universal healthcare, I would first recommend John Oliver's Medicare for All episode. He refutes a lot of counter-arguments that come up when discussing Medicare for All. I also recommend the PBS documentary Critical Care: America versus the World. It looks at healthcare programs all over the world and how they take different approaches to universal healthcare. I want to end on a quote from Leana Wen, the former president of Planned Parenthood. Public health is a powerful tool to level that playing field, to bend the arc of our country away from distrust and disparities and back toward equity and justice. Keep up the good fight.